Sorry, my name is Julian and I represent Tech International. Perhaps for the government, Minister, you spoke about the brain drain of our medical professions. And I'm curious to understand what the government's strategy is on having more medical professionals, or what the incentives are to incentivize small Papua New Guineans to join the workforce, one, and what is the retention plan? And number two, more broadly, there's a message on partnerships across the speakers. I'm also curious to understand if there's appetite between the government, the private sector, the not-for-profit organizations, and development partners, Minister, to an extent, because just from the presentations, there's some really, really good case studies and successful stories. But how do we bring that together from a strategy perspective? Because I think it's possible. We have.
It's an interesting question, and I think we had a meeting yesterday in regards to the workforce. And I think the brain drain is not only happening in this country; it's a global phenomenon. It's quite difficult to retain health workers in poor resource nations. So what we've basically done is that we've brought this concern to the, of course, to the World Health Organization, and we're trying to raise this awareness at that level, so that not just the governments of the poor countries, but also the governments of rich countries can be active participants in regards to stopping this brain drain. Now, in terms of retention strategies, it's quite difficult for a country like PNG. There's nothing we can offer. When a similar jurisdiction like in Australia offers better pay for our doctors, better working conditions, and of course even the smaller island countries who are beneficiaries of aid creation from the US or from New Zealand, for example, Samoa and Tonga. These small countries are also attracting doctors from this country or over. So it's actually a big issue that we're trying to grapple with. And like I said, in the recent meeting we had with the WHO, we raised those concerns, and it's basically a concept that's quite prevalent in very poor resource nations. It's quite difficult to retain doctors, number one. Number two, what we're trying to do now is increase the production of the number of doctors. Because there's no way everyone is entitled to their own lives and the pursuit of happiness, and of course life itself. So if someone wants to go down that path, it's quite difficult for us to restrict that. So what we are trying to do is to increase the number of health workers in our country. And one of such major drives we're doing right now is to separate the medical faculty into its own university now. And that's the meeting I came from yesterday, where development partners coming on board. And because there's so many important stakeholders here, I think we just, in a way, reveal the government's plan. It's quite difficult when we have a fragmented approach to the health issue in this country. When you have resource companies coming on board trying to do their own things, when we have the government trying to do their own things, and of course the politicians like myself, who wants to get elected in the next election, we come and we build facilities in areas that are not needed. So one of the major reforms we're doing right now, we're doing an infrastructure audit. And based on that infrastructure audit, the health department will clearly articulate. We also already have what we call a clinical services plan that articulates where health services should be placed. Unfortunately, a lot of development partners like yourself, the resource companies, of course, the politicians, they don't seem to follow the clinical services plan we have. In a resource-poor environment, scarcity is a huge problem. And trying to use resources in areas that can have an impact is one of the biggest problems we have in this country. And to remind everyone, the mandate of health is given to the National Department under the Health Administration Act. Nobody else should be setting health agendas and priorities in this country. So in this forum, I just want to encourage everyone, please work with the provincial health authorities and invest in areas. After you leave, you will leave behind a huge footprint, an impact, whether it be good or bad. God will govern it, the people will live with it. But you have a duty also to leave behind a robust, resilient health system that can live beyond your time. I looked at the presentations being presented this morning. They are very good programs. But those programs must be sustainable. And that's I think the message that needs to be taken. But on what you said, it's quite difficult for us to prevent people from moving. And we are actually negotiating and collaborating at the higher level so that other countries can also, do their due diligence by protecting medical professionals from poor resource bases from actually exiting their own country.